Imagine a hospital so understaffed that even emergency wards are bypassed, not because patients won't come, but because there's no one left to treat them. Nigeria's health system is issuing that warning. Collapse isn't coming, it's already in motion. The Nigerian Medical Association, NMA, has issued a 21-day ultimatum to the federal government following dissatisfaction with a recent circular from the National Salaries, Incomes and Wages Commission, NSIW, which doctors say violates past agreements on allowances and salary structure, CNMES. The Association of Nigerian Private Medical Practitioners, ANPMP, has joined NMA in raising alarm, issuing statements warning that the health sector, both public and private, is nearing collapse unless urgent action is taken. Physicians cite ongoing issues: poor remuneration, delayed payments, unfulfilled allowances, lack of infrastructure, overwork, lack of retention strategy, and a surging brain drain. That is, many doctors leaving Nigeria or moving to non-clinical or private sectors. The issues in depth: broken promises on pay and working conditions. The controversial NSIW circular purportedly reviews medical and dental officers' allowances. However, the NMA-ANPMP argues it falls short of earlier agreements, and in some cases reverses past gains. Doctors say many professional allowances, CNMES salary adjustments, and other benefits have either not been implemented fully, delayed, or are being ignored. Brain drain and workforce depletion. Many doctors are leaving the country, or considering leaving. The exodus is not limited to those in federal service. Private practitioners also feel the effects because the same talent pool is depleted. Overwork, burnout, inadequate infrastructure, e.g., hospitals lacking proper equipment, poor welfare, inability to replace staff who leave are compounding the issue. Risk to public and private healthcare. Public healthcare institutions are under strain. Hospitals are understaffed, services delayed, quality of care declining. When public healthcare weakens, more people lean on private facilities, which are already straining. Private health practitioners warn that if public sector strike or disruption occurs, private hospitals often lack the capacity to absorb patient overload, especially in rural or underserved areas. What the doctors' demands are. The NMA and private practitioners have laid out a detailed set of demands, over 18-point demands, which they say must be met to avert collapse. Some of these include immediate withdrawal or revision of the contentious NSIW circular on allowances. What could go wrong if nothing changes? Strikes or industrial action. The ultimatum implies that if demands aren't met, strike action could follow, worsening healthcare delivery disruptions. Leadership news. Collapse of public confidence. Once public trust is lost, due to repeated failures, broken promises, it is hard to rebuild. Increased medical tourism. Those who can afford it will seek care abroad, further depleting the local system of revenue and talent. Permanent losses. Doctors who emigrate may never return. Institutions decay. Training pipelines broken. What needs to be done? Suggested remedies. Here are policy and action points that stakeholders are calling for. Suggested measures. Policy implementation. Enforce existing agreements on salary and allowances. Ensure circulars align with collective bargaining outcomes. Remuneration and welfare. Timely payment of arrears, improved wages, housing, hazard pay, incentives for staying in underserved areas. Infrastructure and equipment. Modernize facilities, ensure clean water, power, tools, laboratory services, maintain equipment. Retention strategy. Provide career growth, recognition, reduce bureaucratic barriers, ensure good work conditions. Regulatory support. Empowering governing boards, regulatory authorities, oversight of health institutions, transparent governance. Dialogue and proactive government action. Engage doctors early, not only when crisis looms. Avoid last-minute responses. Retain trust. Government positions and responses. As far as sources indicate, the government or relevant agencies have acknowledged the grievances in some cases, especially regarding the salary structure, CNMES, and arrears. But many doctors say promises are slow to be fulfilled. There has been pushback or reluctance over some parts of the circular from NSIW, seen as undermining previous agreements. Comparison. How other countries handle this. While detailed comparative data is beyond the current sources, some observations. Countries with good doctor retention often combine fair pay, incentives for service in rural or underserved areas, and recognition of professional status. Effective healthcare systems invest in infrastructure, continuous professional development, and regulatory independence. Conclusion. Nigeria's doctors, both in public and private sectors, are issuing an urgent alarm. The health system is not just under strain, it's on the verge of collapse. The ultimatum from the NMA, supported by private practitioners, reflects accumulated frustration rooted in broken promises, poor conditions, and an exodus of talent. What happens now depends on whether the government treats this as a political nuisance or a human crisis. If the 18 demands are met swiftly, if salary issues, professional recognition, and welfare are addressed, if infrastructure gets attention, there's hope. If not, the consequences could be catastrophic: lost lives, deeper inequality, and a deteriorated healthcare system.
Thanks for watching. If you enjoyed this update and want to stay informed with fast, reliable news, don't forget to subscribe to Newsflash 360. Hit the notification bell so you never miss a story. Your next headline is just seconds away.